And today we have the lovely Leslie Heron. And she has over 40 years of direct patient care experience. And through her nursing career, she has provided care in private practice, community, and public health settings, hospitals, and oncology centers. She's board certified in family practice and as a nurse coach. And Leslie currently focuses her work on cancer survivorship, patient advocacy, and healthcare provider wellness. Leslie speaks nationally for professional and patient groups and is the co-author of multiple articles and textbook chapters. She's the founding director of the Cancer Survivorship and Supportive Care Professionals Network, the CSPN.org for any healthcare professionals who might be in the audience, which provides education and peer support for all professionals working with cancer survivors. So with that introduction, I'll pass it over to Leslie.
Great. Thank you so much for that. And there'll be a slide in just a moment or two that's gonna say, give a little bit of who's in the room. And and of course I'm getting a phone call, so I'm going to turn that completely off. Okay, there we go. Sorry about that. Anyway, so if you are a person who would rather put something in the chat, it's okay with me if you do that. If you want to get going ahead as I get my introduction started, I just always love to know who's here so that if there are a number of healthcare professionals here, great. If we're all patients, that's great. If there's caregivers here, that's great. But it helps me to know if there's a specific resource or something that I want to share, if there's something specific. So if you're a chat person, you could get started by just say like, I'll pick on Janet and just say like, Janet, caregiver, or something like that if you are so inclined. You don't have to do that. So I will start sharing my slides though here. And there we are. Hopefully you're seeing those. And sounds good. And I think I have to say that it's okay. The meeting's being recorded. All right. So I am Leslie Heron, and I am a nurse and nurse practitioner. And I always tease when I have all my alphabets up there that's a thing about nurses. We always say that we have to collect the whole alphabet before the end of our lives. And so that we like to share all of our alphabets there. And we're going to be talking today about taking charge of your health in survivorship. And in talking with Christine and the folks at Cancer Choices, we always want to be proactive, right? And something that I am just so passionate about is that if we have the knowledge of what if we can only know what we know, and if we take charge of learning what we don't know, that empowers us and it makes it so that we can then go forward, ask for what we need, advocate for what we need. And if we're not getting it, we're not just in the dark about that, right? We're not just in the dark saying like, oh, I'm sure I'm doing just fine. And then 6 months later, you're like, oh, I wish I would have known that. So I'm hoping that this talk today, my goal is that this talk today is going to encourage you to ask questions, write lists, and go out there and advocate for yourself. At the end of the talk, we will have time for some question and answers, and I do have some resources for you to find out more information as we go along. The Cancer Survivorship and Supportive Care Professionals Network is a resource specifically focused toward healthcare providers and healthcare advocates and more professional folks of all types. And we provide a lot of education for healthcare professionals. So if you have a healthcare professional in your world, like maybe your primary care provider that you love very much, but they don't know as much about cancer and cancer survivorship as you wish they did, that will be a resource at the end. And then Green Labyrinth, which is the logo that's over on your right, is my own personal business about doing things like this, like speaking to all you folks. Oh, Let's see if, hold on. Now let's see if, there we go. Okay. Figure out how my slides advance. So this is my question on who is here today. And I actually now can't see the chat now that I'm in full presenter mode. But Christine, if you can see the chat, if you want to give me
Yes.
a little summary, and if anybody didn't use the chat and wants to come off mute for just a moment and shout out, where you are and who you are. And if you're, just real quick, if you're a patient or a caregiver or a healthcare provider.
Yeah. We in the chat, we've got many cancer survivors, many folks who are patients. We have a couple people who, a social worker, retired physician, caregivers, so kind of a smattering of folks here today.
Perfect. All right. Well, thank you so much, all of you, for being here. And my goal today is that there'll be a little bit of something for everyone to take away. This is the advertisement that went out to you all, but it's to keep me on track to make sure that you're getting what you think you're supposed to be getting from today's lecture. But I really do want you to understand unique health considerations for cancer survivors. Learn what questions you can ask of your healthcare providers. Create a proactive list. This is going to be your takeaway homework of what goes on my list today. What are the questions that this brought up for me that I want to go ask or get more resources on. And then I'll give you some starting places for some reliable resources. And I'm going to stop right here when I say reliable resources. I always want people to go to sites first that are .org as opposed to .com, because and also if you feel that you are in a support group or doing an online chat or something, and something just doesn't feel right, or it doesn't feel like it's based in research or evidence, maybe that's not the right spot for you. Or if you come away feeling anxious and worried instead of supported and empowered, I don't go down that rabbit hole. Stick to reliable resources that are supportive to you. So I'm going to start here with first talking about what contributes to our overall health risk. And this is my thought here is when we think about our health, we think like, oh gosh, yep, I ate 4 pieces of pizza last night. I don't feel so good today. So that's temporary, right? We can eat a big salad today, and then our overall health is going to feel better. But when we think about contributing to overall health risk, oftentimes we only think about the last 6 months or something like that. So I'm going to challenge you today to kind of bring in a little bit more, like your family health history. So what does everybody in your family have? Maybe everybody in your family has cancer, and maybe that is a genetic risk. But maybe many people in your family have diabetes that's related to not eating as healthy, and some of those also genetic traits. And those are more acquired family history. Yes, we can get things that run in a family, but sometimes those run in a family things are because it's our lifestyle that we're used to, and we carry that forward. We also have the family history of things like bone density concerns, or celiac, or high blood pressure, or high cholesterol, and those things that we have kind of, by guess and by golly, have gotten from our families, we carry with us as a health risk. Now, maybe you're a vegan distance runner with great, no cholesterol problems, great blood pressure, and good bone density. But now we're going to throw cancer at you and cancer treatments. And maybe that family history of those things might overtake your healthy lifestyle. So it's something to consider in what's your overall health risk. Then there's your personal health history. And that may be that you were a daredevil when you were a child and, broken arm and a leg, tumbling off your bicycle. Or it may be that you had childhood health issues and then you outgrew those. Maybe you had terrible allergies as a child and you outgrew those and you went forward and you're not having any allergy problems now. Well, now we throw cancer treatment onto that. And maybe those areas where you broke your bones for when you were a kid are more achy. Or maybe those are areas around which there's more osteoporosis that develops. Or maybe those allergies, when your immune system gets a kick in the butt, flare up. And now you've got allergies on top of cancer things. You're like, where did that come from? It may have come from your personal health history. Also, if you used to be a smoker, now you're not a smoker anymore, but now you have a cancer treatment that's affecting your lungs. Your lungs may be more twitchy than somebody who hadn't been a smoker in the past. So thinking about your personal health history. Exposures, and this would be to things like toxins. Certainly we know a lot of airplane builders, ship builders, people from the military, people working in manufacturing may have had asbestos exposures or other heavy metal toxins, things like that, that they may have had in their past. It may have set them up a little bit more toward their cancer or make their body's ability to process a chemotherapy a little bit more twitchy. Illnesses, certainly somebody who has had pneumonia 3 times in their life, we might want them to be a little more cautious with their respiratory health in cancer and survivorship. And stresses certainly can make a big difference in how we cope and how our overall health risk plays out. Social history, and we often don't think about this one with our health risk, but where are we located? Are we close to a big cancer center? We can walk around our neighborhood and find an acupuncture and a chiropractor and a great natural food store right in our backyard. Or are we rural or remote or have to travel a long distance for some of those resources? Economics can make a big difference. Can you afford those fresh fruits and vegetables? Do you have good health insurance? Things like that. Social stresses and social supports are huge. There's a loneliness crisis in the United States where people tend to be kind of isolated. We're on our computers. We stay in our homes. We don't get out there and socialize, and that can be that can really impact our health risk. And then also education level, and then the ability to have good employment and what sort of community do we surround ourselves with? Do we have a stressful community around us or do we have a supportive community around us? And then lifestyle choices, certainly past and present. Like I said, history of smoking, history of a sedentary lifestyle, current smoking, current sedentary lifestyle, our food choices, things like that can make a big difference. And then very last, but not least by any means, is coping skills. And those are things that I always love to remind people that we can learn and improve. Our resilience, some of the things that we don't think about with resilience, we always think, oh, I'm resilient, I can bounce back. But then even going out and helping others seems to booster our ability to cope. Coping skills, breathing, meditation, walking, exercise, things like that. And then also journaling, some of the quieter things, working with flowers, gardening, all of those kind of things. So if we look about this overall health risk, then I'm going to ask you, of these chronic conditions, things like high blood pressure and high cholesterol and arthritis and things like that we think about as chronic health conditions, I want you to just twinkle on, is cancer survivorship a chronic health condition. And so we're going to talk for a couple of moments now about how cancer impacts our health moving forward. So in cancer survivorship, and I do want to stop here and just be clear that survivorship, when you think about kind of the definition, if you look at what the American Cancer Society or other large entities that live in this world say, is they say cancer survivorship begins at diagnosis, and you're a cancer survivor until the end of your life. And with that, I would say that then you're a cancer survivor from diagnosis to the end of your life, but cancer survivorship care, if you will, is something that I define as happening from the time that you are finished with your acute cancer care, like you're done coming in every week for chemotherapy or every day for radiation. From that point, when you're really on the I'm supposed to be getting better phase, or I'm on maintenance phase, or I know there's something low and smoldery and we're dealing with that phase, but you're not maybe necessarily doing radiation, 7 days a week. And so these side effects, when we look at cancer survivorship, side effects happen during treatment. Then we have long-term effects that start with treatment and hang on. And I would say that those are things like the peripheral neuropathy, numbness or tingling in fingers and toes, chemo brain, just being foggy headed, or you come out of the driveway and you can't remember if Trader Joe's is on your left or your right. And you've got to drive around the block until you remember. Some of the other things could be dry mouth, or could be feeling more fatigued. Those things start with treatment, and sometimes they hang on for a short period of time and fade away. And sometimes they hang on and hang on and hang on. And then we have one other piece, and that's late effects. And those are the things that we often don't know about, don't hear about, or we heard about them way back at the beginning at the chemo teach. But of course, then life happened and we completely forgot because it hasn't happened to us yet. And those are late effects, and those can sometimes show up many, many years after treatment. And they may not show up at all, but if we're aware of them, we can be being proactive and maybe keep them at bay, or at least be aware of them when they first show up and can start actively being in charge of treating them. So all the different ways that we treat cancer, right? So I'm just going to start off with surgery. Oftentimes that biopsy or that surgery is the first thing. And I'm going to talk a little bit here about what those late effects and long-term effects might be. So certainly, if you lose an organ or a body part, it's going to alter your body image, even if that body part doesn't show. Oftentimes someone who's had a hysterectomy, that affects how they feel about themselves. Someone who maybe has a breast removed and has a lovely prosthesis, and nobody on the outer world looking at them knows, but they know. And there's many things like that. I think especially folks that have had oral cancers, scars that show that we can't cover with our clothing. And then just the functional loss. Maybe you lost part of a liver or part of a lung, and that alters your function as well. Scar tissue can also be from surgery, and that if scars are showing, but also they can be numb or they can be hypersensitive. It can stop your mobility. If you have scar tissue that's creating what we call adhesions or sticky spots or stiff spots, it can affect your mobility. And then lymphedema, which is where lymph nodes have been removed or scarred from surgery, and then you can get swelling, say like swelling in a hand or an arm or in a foot. You can even get swelling in a face or a neck. So all of those can be these late effects that start because of cancer treatment and hang on, or maybe it's something that comes on later that doesn't happen right away. With radiation, we always say in oncology, radiation is the gift that keeps on giving. Um, you can certainly have from an area of radiation, you can have some scarring, which, refer to above with what scar tissue can do. But then also a late effect that we often don't think about is a risk of skin cancers in the radiation area. And this is something that we can be very proactive and very preventive about. But oftentimes we don't think about it because they're giving us radiation to treat a cancer. Why would we think of it creating a cancer? But very much like if we get a sunburn when we're 6, we're not going to develop skin cancer when we're 7. But if we receive a bad sunburn at age 6, we may be looking at an earlier skin cancer risk, like maybe in our 20s, 30s, or 40s. Now, with radiation that goes through the skin and creates that same kind of sunburn situation for the skin tissue doesn't know that it's supposed to be good for us. Then maybe we have radiation up to a neck area, and then we're out walking around in the sunshine and doing our gardening and getting our exercise outside like we're supposed to be doing, and we're not using sunscreen. We're now double exposing ourselves to that sun, and we might be at risk in 5 years, 6 years, 8 years for a skin cancer in that previously radiated area. So it is something we can be very proactive with using sunscreen, wearing a cap that covers, wearing sun protective clothing. Deep tissue scarring from radiation can happen, and I would love you to think about things like, where is radiation happening if you've had it? Was it over large blood vessels, like, for example, in the neck or in the chest? Was it over an organ, like your thyroid or a lung or a kidney? And sometimes that same sort of scarring can affect things like blood vessels or organs. Chemotherapy, and I'm going to see if I can move my, I don't know if you guys can see your guys' pictures across there, but I can. So with chemotherapy, every organ is touched with chemotherapy. So when we pour that chemotherapy into your vein, and it goes all around your body, it touches some organs more than others, but it does go through everything. It's kind of like pouring water through a coffee filter. It's gonna infiltrate all of that filter, even though what's going to end up happening is that the coffee comes into your cup, but that whole filter gets saturated. So I like to remind people that even though their chemotherapy might have been for their kidney cancer or their breast cancer or their bone cancer or their lymphoma, that it has actually seeped into the other organs. Some of these target organs we think about all the time, right? Oh, you have chemotherapy and you lose your hair, but we're not trying to treat hair cancer, right? And so we're like, oh, but we don't think about, oh, that means it's getting into all of our skin. But it can cause hair loss, nail funniness, sensation changes in the skin, like hypersensitive, mouth ulcers, and other mucosa irritation. Most of the time, that's a long-term effect, starts during treatment and gets better over time. But every once in a while, that'll be something that hangs on forever. The things that I'm going to talk about next are mostly about those late effects that we don't think about. Anthracycline type medications, which often look red when they're hanging up on your IV pole, can very much affect the heart and the chambers of a heart and the valves of the heart. Initially, not so much, but 10 years later, 15 years later, even 5 years later, people can have some late effects on the heart, that they're like, well, we don't have heart disease in my family. I've never had heart problems, but it could be a late effect from the type of chemotherapy that targeted that organ. Lungs are the same way, kidneys, liver. So bleomycin is one that affects lungs. Many of them affect kidney and liver because those are our filters. And so those filters are holding on to a little more of the chemotherapy before they got passed out of our system. And same thing with GI tract. Oftentimes people have nausea or decreased appetite with chemotherapy. That goes away. But because the GI tract held that chemotherapy as it was going through, people can end up with maybe more irritable bowel or colitis problems or things over time. Again, these are things that we can do some prevention on. If we know we're at risk of heart disease or lung disease or our GI tract being off kilter, maybe we can institute some of those supportive therapies, good nutrition, working with a nutritionist, maybe working with some cleansing, maybe some supplements, different things like that that can help our system cope. That brain fog, for some people it goes away, for some people it hangs on. Thyroid can be very affected. Eyes, more dry eyes, or earlier need for glasses, maybe. Bone density and muscle strength. Bone density can definitely be affected by chemotherapy. Maybe it's fine through treatment, but then post-treatment, we want to keep up the weight bearing and resistance exercise so the bones stay strong. And there's a thing with muscles that happens with chemotherapy as well. And that can be that the muscle mass gets thinner and more fatty tissue can get in there. And so one of the things that we encourage people during chemotherapy is to try to get out and walk or do some light weights or keep their muscles strong. If that isn't you and you became a bit of a couch potato during treatment, it's not too late. We know that we can rebuild muscle mass and help prevent that muscle wasting over time. And depending on age, fertility certainly can be affected by chemotherapy. That's something we can be proactive with, things like sperm banking and freezing eggs. But if that was not the window that you were given, at least knowing that early menopause, fertility problems, problems with sexual function of all types can be addressed with some medications or different ways of addressing, like fertility with adoption or something like that. But it is something that oftentimes people don't think about, that they're going to hit earlier menopause or something as well. Immunotherapy, I'm going to say similar, but also different. One of the things that's great about immunotherapy is it's targeted. It doesn't have quite the saturation on all the other tissues because it has more of a guided missile to the target area that it's going to be treating. However, it does have uptake in the whole system. And so all the things I talked about with chemotherapy, yes, with immunotherapy, perhaps a little bit less so, but a little bit more toward that, whatever that target organ or area was. Transplant, autologous transplant means that you gave yourself the cells. That one has lower side effects. You still have to go through chemotherapy, sometimes radiation before that. So all of these go along. And then also, though, you don't have the somebody difference tissue in you, so there aren't as many of the very late effects. But with allogenic, which means that you got the cells from somebody else, it's quite fascinating. But you might go into surgery with one, or into allogenic transplant with one blood type and come out with a different one. I mean, it is that different. And you can imagine that by kind of changing your whole body midstream, that you can have a lot of different side effects. And one of the ones that we really talk about is graft versus host, meaning that where those cells came from and who you had before, when those two clash together, they can argue and can create more of all of these other similar side effects to the chemotherapy. And then maintenance drugs too. We know that, say like post-breast cancer or post-prostate cancer, many people are on maintenance drugs that reduce their hormone levels. Well, certainly that can throw you into earlier menopause, bone density concerns, sexual function concerns, things like that. And then there's also folks that are on maintenance drugs for something that's more of a low smoldery cancer, like a multiple myeloma. And those immunosuppressive medications can affect you long term as well. So we're going to go back to maybe, is survivorship a chronic health condition? And I'm going to say, I think it is. And so when we think about all of those things, our family history, our personal history, our social history, our exposures that we've had, now we've been exposed to these different components of cancer treatment, and it's almost like having diabetes. You for whatever reason, that's what you have now. Well, and you're dealing with that with medications or prevention or being as healthy as you can moving forward. And you get to add cancer survivorship as a chronic health condition. Oftentimes, and I have to say, I did primary care for about over 20 years. And so many times I would see cancer patients in my practice. They didn't have cancer written down as anything in their past medical history. Maybe they had that in childhood and they were like, oh yeah, that was a long time ago. But then I'd be doing their exam and I'd say, oh, is that a port scar? Did you have cancer, before? Oh yeah. And I would add previous history of cancer to their problem list, because that affects the way that I need to look at them and care for them moving forward. I do think survivorship is a chronic health condition, whether you currently have side effects that you're dealing with, if you're having some of those long-term effects that started with treatment, or maybe you're peachy keen right now, but we want to be being proactive about those potential long-term effects. So who takes care of cancer survivors? It takes a village. That's the hint. I'm going to run through this fairly quickly here with, we all know oncology, right? Oncology takes care of cancer patients. But then maybe rehab, physical therapy, speech therapy, exercise therapists, somebody that's addressing chronic pain, maybe palliative care providers that are helping people cope with those long-term effects. If you've had heart affected, maybe cardiology, lungs affected with pulmonology, hormones affected, we threw you into diabetes, we threw you into osteoporosis, we threw you into early menopause, maybe endocrinology is working with you, we messed up your thyroid. Gynecology, urology, and fertility providers. And then there's that whole routine care side that we don't think about, but actually they're the ones who are going to take care of our cancer survivors the longest. If any of you, you finish cancer treatment, you ring the bell or they congratulate you or, scoot you out the door and they say, see you in 6 months. And then you come back in 6 months and they say, see you in a year. And then after 3 or 5 years, they say, I don't need to see you anymore. Well, who are you going to see, right? And it's going to be all these routine care providers. And those are the people that you are probably going to need to educate the most and advocate the most for, so that they understand your special needs moving forward. Your primary care provider for sure. I can't tell you how many cancer survivors I talk to that have not seen their dentist or had their teeth cleaned, all during treatment. And now it's time. How about getting eyes checked? Is that something that, oh, I don't need glasses, so I'm fine? Actually, you need to get in and have those eyes checked. Dermatology, again, especially in those surgical or radiation areas, but also because chemotherapy affects your skin. All of our incredible support network of integrative care providers, naturopaths, nutrition, massage therapy, lymphedema and lymphatic folks, acupuncture, you name it. All of those folks, if you can let them know that you're a cancer survivor, they will be either more proactive or more cautious, depending on the work that they're doing. But it will make a difference in the way that they care for you. Maybe they can look at how the liver and kidney are dealing with toxins, where they might not look at that so much in someone who's not a cancer survivor and otherwise healthy. And mental health. Do not leave that off the table. That can be support systems, it can be support groups, it can be talking to somebody on the phone, but certainly counseling and mental health concerns, fear of recurrence and guilt and survivor guilt and worry are huge in our cancer survivor population. And mental health often doesn't, we hear that you're anxious, but we don't know it's a fear of recurrence, and that can help. So what do I need to ask my providers? You say to yourself. So we're going to talk about both the oncology team side, and then we're going to talk about that routine care side. So with your oncology team, this is where you can really gather data that will make a difference. Given that whole kind of dark gray slide that I gave you with all of those different things, surgery, radiation, chemotherapy, immunotherapy, then this is where you can go to your healthcare provider in oncology and say, what did I have? I know I went to radiation and I kind of blocked that out because it was a really stressful time. You know, what all organs were underneath where my radiation was? And they might say, you know, it was all very superficial. We were just trying to irradiate just under the surface. Your organs actually didn't get much exposure at all. And you're like, yay, okay, good. I'll make sure I'm staying up on dermatology. But maybe they say, you know, we actually had to do deep radiation that went right past your kidney and your large vessels in your abdomen. And then you're like, oh, okay, I need to be making sure that I'm watching for maybe some late effects in that area, like bowel adhesion or something like that. The other thing that I want to bring up is that I talk to lots and lots of cancer survivors who say, oh, I know I had breast cancer, but they don't know what type, or that there are different types, or what stage it was. I hear from a lot of prostate cancer survivors, oh yeah, I had prostate cancer, I had surgery, I had radiation, but they don't know what stage and grade it was. And that is an important thing to know over the long term. Also, whether or not it was genetically related or if there's a related cancer that goes along with what they had. So do ask. I've had a lot of people say, like, oh, I was stage 3, blah, blah, blah. And then they go back and they ask their oncology team, or I get their records, and I'm like, actually, that was stage 1. That's great. And they're like, oh, I thought I was stage 3, and it may have been something else they heard. And it kind of reduces that anxiety down. So do ask. With chemotherapy, some chemotherapies, it makes a difference how much you had, like those anthracyclines that can affect the heart. If you had a whiff of them, not so much. You had a maximum dose of them, maybe more of a risk. Ask your oncology team, what are the known long-term or late effects? Because maybe they told you way back day 2 after your diagnosis, but you've forgotten. And now you're like, oh, I do need to make sure I'm getting my bone density checked, something like that. Is there a risk of recurrence of this cancer? And this is something that I hear an awful lot from breast cancer survivors with a hormone negative breast cancer is my fear of recurrence is high. And that is indeed true in the first few years after treatment. However, hormone negative breast cancers have a less likely chance of recurring late. So if you're already 10 years out from that breast cancer that is hormone negative, you might have a lower risk of recurrence later out, which can again reduce your stress and fear of recurrence. Not that we don't want you paying attention, but maybe that knowledge can be like, oh, actually, I'm 10 years out now. I can take a little deeper breath. So asking about the risk of recurrence, was this a genetic related cancer or a treatment related cancer that might spurn on a different cancer? Again, thinking about those livers and kidneys. Was this a chemotherapy that went through and might set me up for a future kidney cancer? It's a very rare, but maybe you're having problems with your bladder. Maybe that's something that you go in and you say, by the way, I know that I had this cyclophosphamide that can go through the kidney. And could my problems with urination be related to that? And maybe there is some scar tissue or something there, or maybe you can catch a secondary cancer early by having that information. So again, are there genetic risks with my cancer that I had, or are there treatment related risks for other cancers that might come down the way, like the radiation we talked about? How often do I need to follow up and for how long? And that might be with coming in and seeing your oncologist yearly for the first 5 years, but also seeing your primary care, who's kind of doing a secondary double check once a year in those 5 years, and then carrying on beyond that. Do you need to see the cardiologist over and over, or do you just need to go in and have that echocardiogram and be good, and you go back in 5 years and maybe get another one? So ask how often and for how long. Our childhood cancer survivors that have had the anthracyclines that are of risk to their heart, we actually look at echocardiograms on those folks from the time that they're young and have their cancer every 5 years for the rest of their lives. That's a lot of echocardiograms for somebody who had cancer when they were 9. But we're staying on top of that potential risk. And do I need a referral to a specialist? Do I need to see that cardiologist? Do I need to go to physical therapy? Do I need lymphedema therapy? All of those things that are things you can be proactive about asking your providers. And then on the routine care side, what routine prevention would you need anyway? You're a 64-year-old female and you need your mammogram and you need a colonoscopy and you need maybe your flu shot and you need a DEXA scan done for looking at bone density. You need those regardless. You're just a 64-year-old female. And so those are the things that any 64-year-old female might get a recommendation to do. But then because you've brought in your list from your oncology team, and you know your family history, what else do you need to ask? What else do you need to look for? Do you have heart disease in your family, high blood pressure, high cholesterol? Do you have asthma? Have you got terrible allergies? Do you already have diabetes? Do you already have bone density conditions? Those are things then that you're going to be like, I got to make sure that those are addressed. Exercise, nutrition supplements, and then mental health and community supports. So what do my other risk factors influence me that I need to put on my routine to-do list? And then what do I need specifically because I'm a cancer survivor? Maybe if you were diagnosed with breast cancer in your 20s, and we've put you on a hormone suppressive therapy that's decreasing your estrogen level, maybe you are at increased risk for earlier bone density concerns. So we want to catch that DEXA scan and look for bone density early, not waiting until you are in your 50s. Maybe if you have a whole family history of early colon polyps, we're going to want to get that colonoscopy for you earlier. Maybe because you had radiation up in the neck area, we want to check your thyroid more frequently. Or maybe you have more gut problems after your cancer treatment. And so we want to maybe check you for anemia more frequently than the average bear. And again, do you need any routine referrals to additional providers like, say, physical therapy or nutrition? So you can see that by asking your healthcare providers, you bring in the data and then you fill in the blanks, you're going to find out a little bit more. Maybe you don't need much of anything more than routine. Yay, you. But if you don't know to ask, you might be missing something. So how can you take all of this data and then move forward and really advocate for yourself? And that's what we're going to focus on for the next couple of minutes, and then you get to ask me questions should you have some. Know your risks, learn what you need, take this slide deck, and when you get your PDF, and print off those what do I need to go ask things, or pull it up in front of you on the computer and get on the phone. But ask your providers and ask them to help you gather the information that you need. I'm going to throw out there that there are survivorship clinics. If you're down in the California area, Stanford has a wonderful survivorship clinic. If you're up in Seattle, Washington State area, Fred Hutch. There's also down in California, City of Hope, Texas, you've got MD Anderson. And then it's amazing if you start searching on the web for survivorship clinics or survivorship programs in your area, what resources there are. If you can't find one, or you are just, they're out of your area, then search around for a kind of a provider who gets it. You know, who's not going to like look at you and go, oh, you had cancer when you were 30 and now you're 60. You don't have to worry about that anymore. Maybe that's not the healthcare provider for you. You might want to find someone else, or maybe keep them and add someone else. And find those reliable resources. And I do encourage people to keep a notebook or a file or a list or something on your laptop with this data. And then prevention. That is probably the top thing that you can do to advocate for yourself. The healthy lifestyle choices, exercise, nutrition, portion control, sleep. How many of us don't get enough sleep? I will raise my hand. You really attend to those routine care things, not like, oh, I think I had my eyes checked. Maybe it was a couple years ago. I don't know. But keep it on the calendar, so that you are following up and keeping those things on the schedule as needed. Seek counseling, supports, seek community connections. And then also, it is okay when you call and you want to make that healthcare appointment and they're saying, oh, your doctor can see you from 11 to 11:10 on Thursday. And you can say, you know, I'm a cancer survivor. Play the cancer card. I'm a cancer survivor and I have concerns about some long-term effects. Could I please have 2 appointment slots? Could I have a longer time with my provider? And you know, you might not be able to get in that week with that longer appointment time, but it's something that you can proactively schedule to come in and say, can I have half an hour with my provider to go over this data that I've collected about things I want to be screened for moving forward? That is something that you can definitely do and advocate for yourself. What goes on my list, right? And this is the question. This is the real, this is your homework portion. What are my non-cancer health risks and conditions? What do I already have before cancer? Perhaps high cholesterol. And then what's my family history? What kind of exposures have I had? Then what are my cancer-related health risks, given these things that you've heard about today? Oh gosh, I had radiation over my shoulder. I should be using my sunscreen and seeing dermatology, right? What screenings, labs, tests, follow-up, specialist care might I need? And it's like, wow, I've never I've never seen a dermatologist. Maybe I should put that on my list. I don't get in and get dental care routinely. I'd better add that. I haven't had my eyes checked, right? How often are these things due and who does them? If you're more than 5 years out from cancer treatment, you call your oncologist and say, I really need my flu shot. They're going to say, don't talk to me. Right? They're going to have you go out and see primary care with that. What can I personally be doing for prevention and self-care? And if you've been putting off going to the gym, or you've been putting off, adding more fruits and vegetables into your diet, that's your place where those go on the list. Who do I want to add to my support team? Gosh, I haven't ever thought about doing a long-term survivor support group. That would be cool. Or maybe I do need that counseling that I've been putting off, that my family member says I should have. And then what else do I want to learn? And if there's things that I've brought up here today, or things that have been smoldering in your background that you're like, I really should learn more about that. Why do I need to eat more carrots? Then put that on your list. And then here's some ways to find some of those resources. And I just put them in alphabetical order, and there are so many resources out on the web. And what I wanted to give you here was some of the big guns, some of the ones that have really extensive resources that aren't about your cancer diagnosis or your initial cancer treatment, but really about what's available for cancer survivors and long-term survivors. And you'll notice in some of these titles here, like American Cancer Society, yes, they have all of that early stuff too, but they actually have a whole section on survivorship. Cancer Nation, which is kind of an advocacy and political arm about cancer, has a lot about survivorship and survivorship checklists. We've got the Centers for Disease Control about a survivorship care plan. That plan of care, what do you need going forward? If you're a childhood cancer survivor or a parent of a child who's gone through cancer, the Children's Oncology Group has survivorship guidelines based on exposures in childhood. National Cancer Institute, the NCI, has national standards for cancer survivorship. And if your provider says, no, you don't need that bone density exam, you can say, well, the National Cancer Institute says that's a standard of practice. They're going to probably order you that bone density scan. NCCN, National Comprehensive Cancer Network, these are guidelines that healthcare providers use for managing cancer survivors. And again, this is something that they have a patient section as well, and you can bring that in and say, I really need this, and it says right here. And then if your healthcare provider wants to learn more and wants to be that good advocate for you, but they just don't know as much as they would like to, they can log on to the CSPN, which is the site I started, to get education and networking and find these standards as well. So thank you so much for your time, and I hope that this was helpful. I always try very hard to say you can be your best advocate, you can make change, you can really do the best prevention that you are capable of. Our healthcare providers are out there as a resource, but darn it, it lands with us. So I'm hoping that I've given you some resources and some motivation for self-care today. Thank you.
Thank you so much, Leslie. That was such a jam-packed presentation full of useful information. So thank you so much. And for everyone here, that slide deck will be sent out when we send out the recording. So you be patient. It'll take us sometimes a week or so to get the recording all tidied up and up on the website, but you'll get an email with both of those. I know Terry already has a question in here on survivorship clinics in Mid-Atlantic region or Maryland. I don't know, Leslie, if you have a good resource for finding that.
Truly the way that I, even when I was, in my primary care practice, and somebody would say like, I really need a counselor in Alaska, and I would lay by like, oh my gosh, I don't know the counselors in Alaska. Let's go on the web, right? And I do think that it's important to put in the right search terms. So you're going to maybe say cancer survivorship clinic near me if it's Google, or if you've got a bigger city that's close to where you are, you could be like, whatever, let's say, cancer survivorship Houston, cancer survivorship Atlanta, cancer survivorship Vermont, or whatever. And that's a good place to start. And at least it will get you regional. Many of the larger cancer centers do have survivorship clinics, or maybe a nurse practitioner or a PA or a nurse navigator who does cancer survivorship education. Many of them have telemedicine that they can do even if you're at a distance from them. But I would start with that big search, but use that, search terms, not like how, who takes care of cancer survivors, but maybe cancer survivorship clinic, name of city, and to get you going into the right direction. Look for those .orgs and the .edus, which are the universities and things for those resources. Great question.
Thank you, Leslie. Anila has a question about specific tests, screenings, and lab work recommended for breast cancer survivors follow-up.
Yeah, so it depends a little bit on what stage you were, what was affected around the area, how you were treated. Did you, maybe a stage 1 that had some lumpectomy and radiation to the area of the surgery, maybe with no chemotherapy, you go like, oh, I'm off the hook. Well, I would say that what you're looking for there is you're looking for dermatology screening over in the radiation area for skin effects from that, whether it's sensitization or early skin cancers, or scar tissue that's numb or something like that. Maybe it was a more extensive breast cancer where you received 2 different lines of chemotherapy as well as a partial mastectomy and more extensive radiation. Perhaps physical therapy or evaluation for lymphedema. Again, the dermatology for the skin. Maybe we're looking at making sure somebody's listening to your blood vessels in your neck and your heart, because that was underneath the radiation field. And depending on which chemotherapies you received, potentially a little closer look at the heart and the lungs in that area as well. And then maybe thyroid. And then potentially to looking at follow-up mammogram and an MRI. So again, that what informs what labs and tests we need and for how long or how frequently has a lot to do with how extensive the treatment was and what you were treated with. Hence, going back and getting that data. At the very least, getting in for your primary care to take a good look and listen at you and do the standard things every year.
Well, thank you, Leslie. It looks we're right at the top of the hour. So Amy has one last question on screenings recommended for someone on aromatase inhibitors.
And with aromatase inhibitors, what we're talking about, similarly to our guys who are on suppressive hormone therapy for prostate cancer, the things that we rely on our hormones for a number of different things, but bone density is one that really is top of the list. Doing your resistance exercise, we're making sure you're doing maybe some calcium, vitamin D, having the DEXA scan looking for bone density. That's true for our prostate cancer folks, for our aromatase inhibitor folks. Also, vaginal dryness is huge with aromatase inhibitors. So maybe seeing gynecology or talking to your primary care about how to keep that mucosa moist and healthy and happy. I really think if you're doing well on it, stay on it, but stay proactive, especially with resistance exercise and physical therapy, things like that as needed. All right,
Okay.
and I'm going to look at this last one real quick.
This
Yeah,
was, yeah.
I think when you talk to, if you have those providers that are maybe not do not have the time to be your best advocate, find some other keep them in your wheelhouse, but find some others that you can talk to more extensively. So I hope that that was helpful.
Cool. Well, Leslie, this was such a wonderful presentation. And yeah, thank you for sharing your years of wisdom with everyone.
You betcha. So good to talk to you all, and I hope that you each found a little kernel of something that you can take forward with you. Write those lists. That's your homework.
Great. Thank you so much. Have a good day, everyone.
All right.
Bye.
Bye-bye.